Hi there and welcome to our Wednesday session of our Instagram Live. And today I'm going to be joined by Dr. Sophie Shotter, who is one of the Cosmetic Skin Clinic doctors. She also has her own practice as well out in Kent. And she's a very well-known practitioner and has a very, very big following of patients who want to see her. I'm going to get somebody to get her engaged with us because I'm busy yabbering away and I can't see because the lights are on my face. But what is actually post-lockdown treatments, things that patients are asking for, things that patients are waiting for. Hello, Sophie. Thank you for joining. We had a little bit of a moment earlier on when we got onto a different Instagram Live, but I'll tell you about that later. So thank you for joining. How are you doing out there in Kent?
Good. How are you doing?
Yeah, fine. I'm hot. I'm hot and bothered. I've got the lights on. It's very, very warm, isn't it?
Yeah, this is where I wish we had air conditioning.
I know, it's really too hot. But anyway, I was just introducing you and basically saying that what patients have been emailing in about, what patients have been asking us about is treatments after lockdown. And also I've been saying, but I got onto another Insta Live, which I won't tell you about in a minute, but it was about the fact that it's a two-pronged approach. We know that people are desperate to have their treatments, but we're also very aware that we can't go ahead with any treatments until it is deemed correct to do so. And I think for the public, I mean, for doctors as well, it's been a bit confusing. It's confusing enough, but for patients out there, it's even more confusing, isn't it, when they feel that we're going to be open and ready. So what's your view on that? I'm going to put you in the spot a bit about that, just for 2 seconds before we start.
I don't know the answer. I wish we had an answer that just said you may open on this date, you may come for treatments on this date, but I think it's a constantly evolving situation, and I know you're watching things as closely as I am, and all we can do is assess things as it goes and make sure we choose the right moment when it's safe for people to come to us.
Absolutely, and I don't think it'll be that much longer. I think people have been, and I was thanking people for being very patient. I understand that, you know, people do want treatments done, and I understand that there's a lot of patience now for people. You know, people do get fed up. People are on courses of treatment. People are engaged with treatment and want to continue. We're acutely aware of that. But, you know, at the end of the day, as we all know, all of us know, it has to be safe for patients and it has to be safe for staff.
You know, we miss being in clinic. It's not, you know, we would love to be back if it's possible to do it safely. And it's just that constant balancing act between what we want and what's safe to do.
Yeah, somebody actually asked a question there as well, how will you implement safety? And I think that could take up a whole, you know, long discussion. But in short, the way we have risk assessed both clinics at the Cosmetic Skin Clinic. We have 2 sites, as you know, Sophie, one in London, one in Buckinghamshire. We've already done a big risk assessment of that site. Our medical, you know, we've got medical teams that are going in risk assessing. Of course, we're going to be respecting social distancing. Everything will be signposted. There will be just a certain number of people in the clinic allowed at any given time. We're going to be wearing full PPE, visors, appropriate masks, gloves. Patients will be masked and gloved. Of course, not when we're doing treatment, that's impossible, but there will be very, very stringent procedures in place to ensure safety. And I think this will also go out as a very transparent document to patients beforehand, and actually a video as well, so that people can see how their journey will be. And I think that will be quite useful to patients, don't you think, Sophie?
I think so as well. I think if we can show them everything we're putting into place, and also I think there's a lot of people out there who are understanding about, they're keen to get back to normal life, but they're also afraid. And I think when we show them everything we're putting into place to make the experience safe for everyone, I hope it will be real.
Yeah, and I think patients will be reassured. But ultimately, the messaging is this: we're not going to open too soon, but we're not going to open too late either. We're going to do what is right and appropriate, and we're going to engage patients with that. And any queries or concerns people have, totally open to any, you know, Q&A. And we may even do a whole live Insta on that, with Q's and A's, which I think might be very useful for people. But let's get on to the nitty gritty. Let's, you know, I think in lockdown, people do want real content. People do want, of course, we all want to see, you know, really interesting content. There's a lot been said out there, a lot of live instas going on. But that, you know, there's a balance between the fun of live instas and also the real useful content. So thank you for saying that. Someone said a Q&A would be great, and I think it really, really would. Because again, it opens up all kinds. So near the time, and I think it'll probably be another couple of weeks, we'll be in a position to be able to absolutely be transparent with everything. We've got the clinics ready, but then we'll know pretty much when the opening time is going to be, and then people can ask us as much as they want. And if we don't have the answers, we'll find the answers out for you, but we should have all the answers. So let's go on to lockdown, post-lockdown treatment. So one of the things, I'm going to pitch this out there straight away. What do you think, Sophie, people will be really hankering for? I know the most important thing I'll be hankering for, I'll be honest, is not a cosmetic treatment. It will be my hair. But what do you think are the most likely things that patients are asking you about or questioning you and saying, when can I get back and have this treatment?
I mean, you and I both work with people who we've seen and known over so many years. They love having their treatments, and they're very religious about maintaining them. And we will have had a 3-month period where they haven't had their normal injectable treatments, their wrinkle relaxing treatments, their fillers, and they make such a big difference so quickly. And I think for me, I think that's what people are wanting, is the things that make them feel good quickly.
Yeah, and it's the things that require regular maintenance. Again, I'm going to joke about my hair, but it's true. We make a big thing about, you know, the beauty of non-surgical aesthetic treatments and cosmetic treatments is the fact that we make this big thing with patients, which is correct, by the way, is that we are aiming to keep someone looking always really, really good, or we're not encouraging treatments to wear off so that people look great and they're not looking so great, and that we're trying to keep that lovely, lovely, lovely continuity. And of course, by nobody's fault, that continuity has been broken. And that's what people are quite worried about. You know, if I've broken my regular treatments, will that have a negative impact long term on the way I look?
I see it in myself as well. I think it's we see, if we're used to having treatments, we see those changes in our face and we don't necessarily like them. But yeah, for me, I think like you said, hair, nails, I miss having nails. There's so many missing, those of us who do have regimes.
Yeah, I know. And thankfully we can keep skincare regimes going, because of course that's easy to maintain at home. And some people, of course, are doing their own derma rolling. I mean, again, I won't go on to that, but some people are doing quite a lot. Some people are very self-motivated. They do a lot at home for maintaining their skin health, because it is about skin health. But of course, clinic treatments are not so easy to maintain. I think the easiest one, I'm going to throw it out there, I know we can't talk about certain treatments very openly, but we can talk about the principles of treatment. Certainly wrinkle relaxing injections are the ones that have a very quick win. They give very, very quick gratification. For those people who have them done regularly, there is no question that they have great benefit. And of course, a lot of our patients not only have wrinkle relaxing injections for brows and eyes, but they have neck treatment to improve the jawline and neck. So I think that's a very quick win for patients when they come back. I missed that. Sorry, say it again.
Jaw grinding as well. That's another one. I think there's a lot of people who are starting to get headaches breaking through that they're not used to having because of their wrinkle relaxing injections.
Yeah, that's a really good point. And of course, we also know that some of those treatments improve chronic headaches or migraines as well. So actually, a lot of people will be noticing those. And in a way, that sort of reinforces the value that these things may have for that particular person as well. So I think those kind of treatments will have very quick, obvious benefit. What you and I both know, of course, is about filler treatments, that actually the impact of fillers lasts far longer than the filler actually technically lasts. So can you elaborate on that for me, so that patients will also feel better for longer? So talk about that a little bit.
I'm going to ask you a question first. If you had only one treatment that you could have for the rest of your life, which would it be?
Filler.
Yeah, me too, hands down.
Yeah.
So much more than just what people think it does. Yes, we can restructure and reshape and refine contours and balance a face, but we're also injecting something that's actually a really powerful collagen stimulator that's making your tissues healthier and younger. And the quality of the skin that overlies that is, particularly from a month onwards, it's noticeable. People come in and they've got this glow, and it's the filler that's impacting the overlying tissues. And for me, you just can't beat it.
I mean, that's really interesting, because I think, and again, I'm speaking about this, I've spoken about it many times. I don't want to keep banging the same drum, but it's nonetheless very important that I think that sometimes people, think filler is just a quick fix, done. Of course it is. We know that. It can give instantaneous results, which is fabulous. But the long-term collagen stimulatory benefits are largely not really appreciated by most of the public, and I think maybe that's because we don't make enough of it. But we know that there's hardcore data on this that proves that to be the case, that it stimulates natural collagen, but people don't know that.
And the fillers that we commonly use in clinic will last anywhere from 12 to 24 months, depending on the product. Lips maybe a bit less, anything in this area, but this is why those products sit there and they give you an ongoing improvement benefit. And then how we work is we tweak and we maintain and we make sure that you're not getting those dips, but it means that the benefit that the treatment gives lasts a lot longer than our wrinkle relaxing treatments.
Yes, and I think that's why actually lockdown people are probably noticing that the wrinkle relaxing treatments are the ones that are breaking down first. But that is what it is. I mean, you know, these things can't last any longer than a certain amount of months, but fillers do. So actually that's really positively, you know, good that people can see their skin quality is still very good. I think as well that, again, a favourite of people post-lockdown, I think, but a favourite before post-lockdown was natural collagen regenerating treatments like Profilo.
Absolutely.
Because everywhere you go, every practitioner pretty much that you talk to, that we all agree that there's certain game changers in the industry, things that really alter the way we treat patients. And would you say Profilo is one of those things?
100%. It was a disruptor. It came along and changed changed the confidence with which I could say we can really change your skin with injectables. Because as much as there are different products around, for me, the results I've consistently had with Profilo have just been phenomenal. I love it.
For those people who don't know what Profilo does, can you just elaborate just a smidge on that?
So it's a hyaluronic acid, but rather than being turned into a gel that lifts and changes the structure of the face, it's the texture of runny honey. So it spreads through our skin and switches back on our collagen and elastin production. So it actually remodels the skin and makes it behave differently.
Yeah, which is clever. It's very, very clever. And where do you think you'll get your best results? So in your patients and your feedback from patients, because at the end of the day, it's all about them. It's not all about us. What feedback do you get? What areas do you think patients see the most benefit? Is it faces? Is it necks? Is it body? Where do you get the positive feedback back?
Everywhere I've treated, actually. I mean, mostly I treat faces and necks. That's the most common areas I treat. People who invest in their décolletage as well really notice a difference. Hands, I've had some really nice results on the loose skin on the arms as well, but it does a little bit more another session usually on average. But I've noticed positive results literally everywhere I've tried using it.
Yeah, that's impressive too. I think it's, I mean, body parts, of course, take a lot more treatment. And I think that's absolutely, you know, true. And it can, you know, you have to be quite creative about the way we work with bodies, but it can have a great result with bodies, particularly in combination with other treatments like cool sculpting or whatever. But I certainly think that, and certainly on this part here, and, you know, just that lack of oomph, just to give that bit more oomph. And somebody's actually asked, and this might be a bit contentious, but let's address it. What is our opinion on Volite versus Profilo?
They're different. I often combine and layer them. So I see Profilo as a very powerful collagen remodeler, and Volite as an sponge. So Volite sits within your skin for longer and holds moisture there. So actually, my favourite, if people are prepared to invest in it, is actually Profilo, Volite, Profilo, and it's beautiful.
Okay, so one regenerates, one hydrates
Yeah.
more. Is that what you're saying? So so you're using that combo.
Yeah.
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 Okay, yeah. I mean, the way I see Profilo is a bit like, as you know, in the good old days, and I go back, sadly, many, many years, you know, I used to use Sculptra. I mean, I still do, by the way. But, you know, these collagen generators, things that are not fillers, they're things that actually stimulate natural collagenesis even more than traditional fillers, because we've already said fillers generate some collagen. But something like Sculptra, injected deeply, gave beautiful, very gradual, you know, really very, very gradual, but very, very gradual lift to the skin. And I see Profilo, it's different, it doesn't volumize, but that's almost a similar sort of concept, is that you're harnessing your own tissue to do the work. Whereas with fillers, of course, we're helping it along its way a bit more. We're giving more oomph under the skin, aren't we?
It's the power of your own body. And I mean, Sculptra is something that I don't that treat. I've overlapped with you on many of your patients, and I really see there are some faces for whom Sculptra is just perfect, and the results are beautiful.
Yeah, I'm probably one of those people. Yeah, I'm probably one of those people, because there are certainly some people who've got that very fine, very thin skin, that really, really thin skin, that actually we find that fillers are not perhaps the only answer to. You know, we could combine collagen stimulating treatments with maybe a bit of filler, maybe with a bit of all therapy. You know, we're not saying we're overloading with, you know, mega amounts of anything, but just sort of using different ways of getting optimization in the treatment result. And that's where we can be quite creative, isn't it?
Absolutely.
So one of the go on.
Question come through, which was, and I think it's an interesting one, what do we both think is the right age for people to start having these sorts of treatments, and do we believe in prevention?
So the answer to the second question is yes. And I'll talk about that in a minute. The right time to start, of course, is a bit of a contentious one, isn't it? Because again, the media perception is and I would say actually preventative, you know, preventative treatments are worthwhile. I think starting earlier rather than later. And then there's this, what age? You know, people try and drill you down. What age? You know, and actually there isn't an answer to that, is there, Sophie? Because actually, I remember, and I say this a lot to patients, you know, I've got that very fine skin in my late 20s, actually between mid and late 20s, sort of 27. I could already see I was getting lines around my eyes that weren't going. There are other skin types, of course, that we know won't see lines around their eyes or anywhere else for years and years and years. So we can't say absolutely this or that age. We all know that skin quality is important. We advise our young people on use of sunscreen. We advise our young people on use of maybe antioxidants, you know, that are not going to break the bank for them, that they're going to just look after themselves. We also know that very, very light regenerative treatments like either microneedling, microneedling or derma rolling, or things like clear and brilliant lasering, which was designed for the very young, wasn't it? It was designed to just improve the texture, tone and luminosity of the skin, stimulate. I think they're great. And they don't break the bank. They don't make people spend fortunes in their sort of 20s and 30s. It feels comfortable to us to recommend those things because they have clinical benefit. And they're not going to be spending a fortune on these things. But I think, again, you and I both know that it's proven that things like, you know, wrinkle relaxing injections at the right moment for that person, that can be anything between late 20s to 40s, can actually prevent, you know, etching of the line settling. And we know that if we repetitively sit on leather and crinkle it up, we're going to get permanent lining in that fabric. It's the same with our skin, isn't it?
Absolutely.
So I think it's a bespoke, you can't answer that broadly. You've got to say, I do believe in prevention. I believe in not making young people obsessed about looks, because I believe that's truly unhealthy, very unhealthy. But I also believe it's our job to educate and allow them to make the right decision for themselves. And that's
Yeah,
hard, isn't it? What do you think?
very. I exactly the same as you. I think I've seen 60-year-olds with the skin of a 40-year-old, and I've seen 40-year-olds with the skin of a 60-year-old. And so I believe in looking at the skin in front of me and the face in front of me. And if you can get in there when the line, you can see where it's going to be, but it's not there at rest yet, that's the perfect point. But you and I talk a lot about the concept of a collagen bank, and the fact that we all have this finite amount of collagen, which from the age of 25 starts to dwindle. Speeds up at menopause, and then actually still accelerated rate afterwards. And whatever we can do to keep that collagen bank topped up at a young age, I'm a big believer in. So like the sorts of treatments you say, microneedling, even Profilo actually, I think can be great from a
Yes.
relatively young age.
Absolutely.
Yeah.
And you know, we will be biased, because we, of course we are, because everybody that works in the industry and people that work within their clinics get great results with whatever they use. Otherwise they wouldn't have those things there. They wouldn't have the technologies there. So we're of course we know the broad offering that we have, because that's our job to know what the broad offerings are. But I absolutely think that there's another question that's come up, which I'll read in a minute. But I think that ultimately things like even all therapy now, we used to only use all therapy, skin tightening and lifting on a more sort of 40s to 65s. And of course now what we realize is we don't have to go crazy and do this mega treatment on everybody. We can actually give a preventative, very effective preventative treatment on a slightly younger age category. So A, it doesn't become cost prohibitive, and
Yeah.
B, it's wholly appropriate. And I think if I had that when I was younger, which I didn't, I would probably consider that. I would look at that as a preventative measure, because I'd still want to keep looking natural, but I'd want to invest in this collagen bank, which we will talk about.
Yeah.
And I think that's really, really important.
Absolutely. I think it's the more we can keep it topped up before it's depleted too much, the easier it is to maintain.
Absolutely.
So yeah.
Absolutely. And we both know that the rate of aging from about perimenopause to menopause, 50s up, just is really quick. And that, you know, there are periods of time with all of us, you're a bit young for this yet, Sophie, but I'm not, that actually you feel you're doing well for a long time. You think, well, actually, I look, you know, really, really good. And then it seems almost like overnight the rot sets in.
Yeah.
And you almost wake up and think, oh my God. And that is absolutely true. Any woman that knows what I'm talking about. And you just think, I can't believe it. How did that happen?
I believe we age in spurts, the same as we grow in spurts. I think we go through these periods where we age very rapidly in a short space of time, and then we plateau for a period as well. But yeah, I think the stats I've seen most recently are that from 25 onwards, we start to lose 1 to 1.5% per year of our collagen. Within the first 5 years of, yeah, then within the first 5 years of menopause, we lose 30%, and thereafter it continues at a 2.5%. So it's still a sped up rate. So
yeah.
Through what you observe.
No, it's absolutely true. I've got a question here. It's a really good one. Someone said, I'm scarring on my chin area, which pulls my face down. My lip is down on one side and nasolabial folds are worse. I'm 53. What filler would help my drawn appearance? Would you like to take that one on, Sophie?
Yeah, sure. I mean, first of all, it is difficult to say without seeing you. So photographs are helpful, and for me, obviously, examination is really important. But fillers are a brilliant treatment for. We can even work with filler to slightly loosen up scarring and improve tethering. We can definitely work to improve symmetry and facial balancing. The treatment might not just be here. We often start further up the face. But yeah, it would. From what you've said, it would probably be my first treatment of choice for you.
Yeah, and fillers, and they can vary a lot. And again, depending on what clinic you go to, depending on what practitioner you go to, people will have their favourites. Now, generally speaking, they have their favourites because in their hands, it gives them the best result. Yeah. So actually, you know, when patients come in, don't they, Sophie, and they go, I want this, I want that. And sometimes patients are right, by the way, you know, you say, yeah, actually, I think you're right. But there's sometimes people come in and want a certain product or want a certain treatment, and it may not be ideal for giving them the best clinical outcome. So again, it's up to us to try and guide that patient. And so in answer to the question about different fillers, there are so many really good ones. I think generally speaking, truthfully, really truthfully, I think the names, I'm not here to promote certain brands, but the names that you've heard out there in the industry, the really good hyaluronic acid gels that are biodegradable, dissolvable, tend to be deemed now the gold standard. The gold standard. You want FDA cleared products that are proven to be safe and effective. But you know what? You want to choose your filler, but you want to choose your clinic and your practitioner. And I've always said this, of course, we're all out there, you know, to have our patients come through to us. But let's be honest about this. There's a practitioner for everybody. There's somebody that you will trust as a patient, that you go to see, you'll have your consult, you'll feel really, really comfortable with that person, and you really feel you sort of gel, and that they've just got it. They've got what you want. And I think, of course, we're all biased, as I keep saying, you know, we run our own clinics. But actually, when you go to a place that's right for you, you'll pretty much know it's right for you. And my other advice, I've slightly digressed, is whatever filler you do, whatever you have treatment, you know, do that journey with that practitioner. Do it with them, get the feedback. If it's not quite the way you want it, go back. Because I think most people, all of us, are searching for that filler, that practitioner, that perfect thing. And actually, do you know what? If you go to a very good person, you'll get a great treatment. It's just about getting that engagement, don't you think, Sophie? It's very bespoke. It's a very unique individual thing. And I've gone on a bit about that, but I feel quite passionately about that.
Me too. And I think what we do, I see it as art. We are sculpting, but with a face. It's where medicine meets art. And, you know, there are great artists who work with oil paint, and there are some great artists who work with watercolor. So it doesn't necessarily matter which tool they're using, so long as they're using one of the good reputable brands. And what's far more important is that you feel they understand the concept that you want, that artistically what you're trying to achieve is aligned.
Yeah, absolutely, because everybody wants something different, you know. And what we perceive, you know, I will only refuse to do treatment if I feel it's not in the patient's best. Well, first, if it's not safe, that's a given. But if it's not in the patient's best interest to do so, you know, if I feel that it won't enhance them, if it won't look good, even if the patient wants it, I'm afraid I will always reserve the right to have my opinion. Then they can go somewhere else. And I don't do that in a, you know, difficult way. It's not an uncomfortable conversation, is it? It's something that we feel is right if we can't deliver. But because I have very strong views about what I think will enhance people's faces, and you know, people are just lovely. Generally, people have got the most wonderful faces, and I love to work with them in all kinds of different ways. But I think that it is about choosing that right person. And we're getting some really good questions. I'm really very pleased we have. There's a lady that comes from 56, typical oily skin, post-menopause, and then what she wants to know is the skin on my nose. Oh yeah, I know. The skin on my nose has pores, which is seemingly getting bigger. Yeah, do I know about that? Do I need a stronger retinol? I've been using retinols of low strength. It's a really hard one, isn't it? The breakdown of collagen on the nose and the pores that become, from being tight, become elliptical and visible. Any top tips, Sophie?
So firstly, retinols will not work as effectively post-menopause as they do at pre-menopause, and that's to do with the fact your estrogen receptors on your collagen-producing cells have switched off. There are now some things creeping through to switch that back on and help. But specifically on the nose, you can consider a prescription strength retinoid, so something called tretinoin, and that can be effective for tightening pores in general, but I find it's better on cheeks than it is on noses. And then what do you think about things like Tixel pores?
Yeah, I think it helps. I mean, I think that once pores have become very dilated and visible, it's really, really hard to correct. I know how you feel, because I've got the same, and I haven't even got oily skin. Normally you see this more in oily skins. The beauty of oily skins is they don't line as much, but the negative is you can see pores. So, and this classic area here. And as you get older, that really tight, lovely pore becomes elliptical and sort of joins up with other pores, so it becomes very obvious. And it's not attractive, I know. And as we get older, and this is me. I use a magnifying mirror to put my makeup on, and my goodness, you see every pore screaming at you. So it's really, really hard. I think it's multidisciplinary, which is what you were alluding to there, Sophie. I think it is, we can't get rid of them completely. That's truthful. I think that if we use topicals with maybe skin quality improvers like Tixel, which will use a heat source to regenerate and remodel collagen at superficial level. Some people will use lasers. There's a couple, 2 or 3 treatments you could sort of use over a period of time, sort of layering, that will improve your skin quality there. But it's really, really difficult. And of course, what we have to understand, don't we, is that in menopause or postmenopause, a lot of women suffer with rosacea, and they suffer with almost a mild sort of rhinophyma. I'm not saying this lady has, but the noses can almost look almost like a rhinophyma. We know what we mean by that, but looking sort of not as healthy.
Exactly, and it's a distinctive. Yeah, it's something that I think recognised. I think rosacea, actually full stop, in all age groups is under recognised over here, but I think perimenopause, it's definitely a trigger. Hormones set it off, and yeah, the nose, it develops almost like a bulbous shape at the tip.
Yeah, absolutely. Yeah, I think it's multidisciplinary. What you'd need to do is have someone have a really good look at you in clinic and see what might be a good idea. But pores are a nightmare. Overall, pores are a nightmare. Lines, volume loss, lining here, net. Do you know what we can do pretty well, pretty quickly? But pores are really, really hard to address, and they're one that's a big problem, aren't they? So Sophie, you're talking about, let's go back as we're wrapping up, because we could talk forever, but about post-lockdown. And how we all feel about this time that we've had, and there's so many people now talking about it, almost overloaded, aren't we, with information,
and it's coming at us from every angle at the moment.
Yeah, it's very, very, very difficult. A lot of people that have a lot of neck treatment, again, I noticed this in myself, was, a lot of our patients have relaxing treatments in the neck to stop this sort of banding here, to give more elevation. I think a lot of patients have been saying to me they've noticed that their necks are looking not as good as well. Because they've been having regular treatments on them and they haven't had opportunity to do so in lockdown. So what is your favourite treatment for necks?
I love the combination of relaxing injections, phyllo, and ultherapy. So that for me is my golden triad in the neck. And if someone has
can you explain what each of them do,
yeah,
Sophie, so that people know?
Mine are wearing off a bit. So you see the that comes, that's what the wrinkle relaxing injections help with. And what's amazing is every time we clench that muscle, it comes up into our face like this. So we clench it and it pulls our face down. So keeping that relaxed also helps our face shape. Then Profilo for improving the overall skin quality. It can slightly help with the banding lines we can get as well, which when we've been doing a lot of this with our phones and devices, is an issue. And then ultherapy for collagen stimulation and for deeper tightening. You just can't beat it. So coming up into the lower face, because again, everything starts a bit higher. And it is important that if someone has got a weak jawline, that we reinforce that as well, because that can help with a double chin and all sorts of things.
Yeah, and I think you keep saying and referencing that we treat higher. And I think sometimes patients don't realise this. Obviously, when we do a full consultation, we explain why we say that. But, in the good old days, we just treat sort of nasolabials and marionettes. And by the way, though that's become a very passé way of treating, it actually did the job quite well. We can't sort of diss it, because actually doing a bit of nice sort of filling here worked really quite well for a lot of people. And what we're doing now is, because the techniques and the way we inject and the products are so good, we work from high up to give more lift and balance. But going back to what you say, we start higher up. That's because, isn't it, Sophie, that it's a bit like having a coat hanger holding up our clothes. If we actually put the coat hanger up here, our clothes, which sadly are the droopy skin, actually get sort of lifted up from higher. And it's important to sort of explain those concepts to patients, because sometimes it's difficult for people to understand that.
I mean, you know, most people understand that we lose collagen as we age, but actually we also lose the framework of our face. It shrinks, and so that hanger is actually getting smaller. So it's like going from hanging your clothes on an adult size coat hanger to one for age 7 to 9. And so just nothing as well as it used to.
Yeah, it's a really good, that's a really good way of putting it, actually. So just as a wrap up, we have digressed a bit, but I think it's been really good because we sort of talked about a lot. Firstly, what do you think we've sort of touched on this, but what do you think your patients are going to be coming back, sort of going, right, I want this now and I want it, you know, immediately after lockdown? And what actually is your favourite treatment? I think I know the answer.
Yeah, it's the injectables that people are going to want, the wrinkle relaxing injections, the fillers and the collagen stimulating treatments. That's what I think the demand is there for at the moment. People are missing it. My favourite treatment, I think, is the same as yours. I love filler. I love working with it. I love helping people, just the whole journey with filler, really helping people achieve a significant and lasting change. And it is, as I said, medicine and art combining.
Yeah, it's a really good point. And I think what I might do in another live Insta, maybe get a few of us on if we can, I don't know if you do that on live Instas, is talk about, you know, where fillers, where this poor perception of fillers comes along, and maybe, you know, talk about when people do have too much in one area. It's a bit like, look, it's very simple really. It's a bit like hair colour or makeup, or, you know, never showing your cleavage as well as you're having a short skirt. I know this is sounding very, very simplistic, but sometimes, you know, with filler, just enough, not too much, in the right place, looks stunningly beautiful and looks, you wouldn't even know, would you?
Yeah.
Whereas if you overdo something, or it's all slightly off or slightly unbalanced, it looks dreadful. And I think maybe we'll have a whole sort of episode, you know, talk about when things do not look good and what that's due to. It's a sort of educational point for people.
Yeah,
I think that's,
yeah.
Yeah. So thank you, Sophie. What are you going to be doing for the rest of your day? It's a lovely comment here. Thank you. I've just moved to Kent. I'll come and see you, Sophie. Isn't that lovely? That's really, really nice. That's really, really nice to hear that. Thank you for those people who've been engaged. So what are you going to be doing for the rest of the week? Getting your clinic ready, liaising with us to get our act together and getting ready, but we're pretty much nearly there, aren't we?
I think we're both on the right track. I'm still waiting for a few deliveries of things and that I'm putting into place at the clinic. But it's funny how life hasn't got less busy. So between planning and meetings, it feels, I'm glad actually to be busy. How about you?
Yeah, same. Getting everything in place, as you know, because we're liaising about the Cosmetic Skin Clinic stuff. But it's just a good time to get a house in order. But I think, as I said, we can't wait to get back to treating patients. And I think this is where live Instas can just keep people engaged. And, you know, it's great fun to be able to talk to patients like this. So thank you, those of you who've joined us today. So thank you, Sophie. I'm going to cut it there, so people always want a bit more. Enjoy the rest of the day. Thank you so much for joining me. And thank you, those guys